Good afternoon, everybody. My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Sciences here at Boise State University. I'm excited to have you attend this information session put on by the University of Utah School of Medicine. I'm also joined in the room with Shannon Kerr, our Pre-Health Advisor. She works with students who are primarily upperclassmen, so sophomores and juniors. And if you are one of those, you should be reaching out to her in the near future about registration, as it is coming up pretty soon. And then I work predominantly with those who are in the application process, and we all work with freshmen, sophomores, juniors, and seniors. And we're excited to have you all here today. I'm going to introduce Miranda Martinez. She is one of the representatives from the University of Utah.
That's awesome. So like Erin said, I am Miranda Martinez. I work for the University of Utah and the admissions coordinator. Emily, would you like to introduce yourself?
Yes, hello, my name is Emily. I'm also an admissions coordinator for the School of Medicine. And we are happy to be here and answer your questions. I will pass it off to Kylie, who is one of our RUUTE team members, and she can introduce herself.
Great, thanks, Emily. Hi, I'm Kylie. I'm with the Rural and Underserved Utah Training Experience Program within the School of Medicine. So we work really closely with the Office of Admissions, who obviously you're going to hear about today. But for our students here in Utah and in Idaho, Montana, and Wyoming that are from or want to participate in rural initiatives at the School of Medicine. So we will share a little bit about our program as well, and we can answer questions. But I will turn it over to the real expert of RUUTE and Idaho, which is Laura.
Thanks, Kylie. Yes, my name is Laura Herring. I am a coordinator with the RUUTE program, and within that we have Idaho Affairs. So I work as the Idaho Affairs coordinator, and I work directly with Idaho students once they matriculate to the School of Medicine and help them get involved in all sorts of rural outreach programs that we have available. And I'm also here to help you as a current undergrad student if you're interested in becoming one of the Idaho students at the School of Medicine. So just let me know if you ever have any Idaho questions, and I'm here to help.
Awesome. And then we also have 3 of our current students with us. So Tyler, if you want to start introducing yourself.
Yeah, hi, I'm Tyler. I'm 25, pretty traditional med student. I just took a year and a half off between school. I went to Boise State, worked in a research lab afterwards with Dr. Cornell. I don't know if any of you have a class with him. I think he teaches biochem. But yeah, I love it here. Ski as much as I can, golf as much as I can, which is a joke in med school, but there really is time for stuff, and look forward to talking with you guys about it.
Allie, if you want to go next.
Sure. My name's Allie Cruz. I'm a 4th year med student at the U, and I'm from Idaho as well. I went to the College of Idaho in Caldwell. I'm applying for residency right now in radiology.
Awesome. So that leaves me. I'm Sajad. I also went to Boise State University. I graduated back in, I think it was 2013. It's been a while. After graduation, I got a master's in counseling, and then I realized that I didn't want to do that. So I made the switch back to original plan, which was med school. And then here, I actually also worked with Dr. Cornell in research with Tyler. So yeah, so that's about it.
Awesome. Okay, I'll share a PowerPoint with you all. We will go through this, and then we'll have RUUTE go, and then we'll follow it up with a Q&A. So if any questions you have, you can put them in the chat now or wait until the end. We'll make sure we get them all answered. We're kind of going off. So this is kind of just an admissions overview. With the University of Utah School of Medicine, we use a holistic review process. So we aren't just looking at your GPA and MCAT scores. Those are important to have, but we will look at your entire application. So we do definitely encourage applicants to participate in a variety of activities, showcasing your experiences, your passion for medicine, just kind of why you want to become a physician. Those are great to have as well. These are our requirements. So we do require a bachelor's degree in any major. So you guys are all set there. With GPA, it's a 3.0 or higher in all sections. So in your science, non-science, and overall. MCAT scores, it is an overall score of 500. This is just barely updated this year, so we are no longer looking at sub scores, but 500. And then we will only consider your highest score. So if you guys retake it and you get a lower score, we kind of just ignore it and we'll look at the higher one. This is different for other schools, so make sure when you're looking at schools that you're applying to, you keep that in mind. Some of them will only take the latest MCAT score. Letters of recommendation, we require 3 letters and up to 4. Coursework required: chemistry, physics, biology, writing, social science, and humanitarians. One thing to note with this is we do not take IP or AV credit. So make sure you guys are looking over our requirements for coursework and getting those done. We will accept the chemistry credit with a score of 4 or 5 on that AP test. So that is the only one that we will make, only one we'll accept. So all other AP and IB credits won't count to those course requirements. The activities that we look at on your secondary application as well are those clinical experiences, so shadowing, really direct patient care in any clinical setting. So make sure you guys are getting involved with that. Community engagement, so again, this is leadership and volunteer experience, community service hours, and then intellectual curiosity. So this is anything that's research, your capstone projects, thesis, poster presentations, awards, recognitions, anything else really kind of goes in that section. Some tips for these is to participate in clinical experiences. We really want to make sure you are getting involved in a clinical setting just to make sure that you want to become a doctor. We've seen applicants who haven't gotten involved in it and later on they decide it's not for them. So definitely get involved early on, make sure it's what you want to do. It can also help you figure out where you want your career path to go. So get involved in that. And then we also suggest not just to meet our activity requirements. We want a diversity of experiences and variety. So get outside your comfort zones, definitely try new things, but definitely try to avoid checking boxes. Again, the admissions committee wants to see you having a variety of activities and that you're getting out on your own to do these activities, not just doing them for classes. And then additional helpful hints. Not all forms are the same, so make sure you guys are reading instructions. Don't just copy and paste things over. Some things will ask for different things, so pay attention to details and manage your deadlines. You guys are going to probably applying to multiple schools, so make sure you stay up to date on when those deadlines are due. They're not going to all be the same, so pay attention to that. And then visit those pre and med advising offices. Advisors are your friends. They know a lot of the requirements for each school. They can help you with course requirements as well, and really throughout the entire application process. So definitely reach out to those pre-med advisors. Kind of going into more of what we look for during our interview day, assessment days. We are looking at different competencies in various areas, communication skills, and how you make decisions. So we have 3 different assessments that we do: our standardized video interviews, our multiple mini interviews, and then a situational judgment test. We'll go into more detail with those. So with our standardized video interviews, these are one-way asynchronous video interviews. So these are done prior to your interview date. Your answers are going to be recorded, and there are practice interviews with this as well. So we definitely suggest using those practice interviews on them, getting comfortable with the platform that they're on. And these are going to be reviewed by 2 committee members. So they get reviewed. Multiple mini interviews. These are a series of one-on-one interviews. They're about 8 minutes long, so pretty fast. Unlike your regular interview where you're asking more of information about you, the interview is trying to getting to know you. These ones are trying to see how you respond to different scenarios. They're situational based prompts, and you're kind of just answering how you would respond. So again, we're looking at your critical thinking skills and your communication skills with these. And then the situational judgment test, it's an online proctor test. Again, it's the problem solving. So it's issues that you might face in school or clinical settings and how you would respond to those scenarios. It's again, online, super simple, but these are all done during the day of the interview as well. Some stats for you Idaho students. So with Utah School of Medicine, we have a contract with the state of Idaho to accept 10 Utah residents each year. You must certify your residency with your state. And then all Idaho students are considered out-of-state residents. However, you will pay in-state tuition. And the Idaho kind of makes up the out-of-state cost for you. So it is a good deal for you guys. And then you do have opportunity to return back to Idaho for shadowing, teaching experiences, and more things like that. So you can definitely come back and work in your community, things like that. These are just some class statistics for you all. So we had 3,806 applicants in the 2021 cycle. We have a total of 125 seats. So 85 of those seats have to go to Utah, 40 are non-residents. Like I said, those 10 Idaho seats for you. Our average GPA is that 3.78, and then the average MCAT is 513. So that's kind of just a breakdown for you. With our MD PhD program, so if any of you are interested in that, this includes a 3 to 5 year thesis with a graduate program between the second and third year of medical school. So it is a little bit longer of a degree. Strong applicants who are wanting to apply for the MD PhD should understand the scientific pathway and have rigorous scientific training at least 1 year to meet those criteria. It provides a fellowship and tuition costs for students during medical school and graduate school training. With this, again, you'll apply through AMCAS, but then select the PhD program. So it won't affect your MD application. If you aren't accepted to the PH, you'll still be considered for the MD. So that's an option for you guys as well. And then again, applicant stats for you. So with the MD PH program, there's only 68 positions each year. They receive about 129 applicants and they only interview 32 of those. Average MCAT is 514 and then GPA is 3.7. So you can apply throughout your second year of medical school as well. And then these are just some of the online resources that we have. You guys can keep up on our changes that we make to our application process, things like that. So our website is definitely a great resource for you all to use. Any changes that we make gets updated on there. So definitely check out that website. It's very helpful. We have an Instagram account as well. So you can follow us on Instagram and Facebook, YouTube as well. And then we do have a podcast that Dr. Chan does. He's the Dean of Admissions. So it's super interesting. You can listen to him. He kind of gives you some more information on admissions and other medical things. I'm going to hand it off to RUUTE right now. You guys want to take
Yes,
over?
I can hop in here. So as we mentioned before, the University of Utah School of Medicine has a program called RUUTE, and that's the Rural and Underserved Utah Training Experience. And we've also added and regional affairs. And so that includes Idaho, Montana, and Wyoming. And so two of the programs that I'd like to highlight as really important to you all right now are the RUUTE Undergraduate Ambassador Program and the RUUTE Scholars Program. So the RUUTE Undergraduate Ambassador Program, Miranda, I think we lost the slide that we were on. I think it went back to the beginning. So the RUUTE Undergraduate Ambassador Program is something that if you are an undergraduate now and you have at least 2 semesters of undergrad left, you can apply and you can work with RUUTE at the stage that you're in now, which is really exciting. And we hope this is an opportunity for you to get some professional development, to get some face time with the School of Medicine and the RUUTE team, and to give back to your community a little bit. So to explain it, you work with RUUTE for 2 semesters. In the first semester, and everything is virtual, so there's no need for you to be able to travel or leave your home state or your hometown or anything like that at all. So the first semester you work with us and you participate in weekly modules and courses with us, and we teach professional development. We have a session from admissions where they talk about kind of similar stuff to this, about how to apply to the School of Medicine. And then we really focus on teaching you how to plan and develop a lesson plan and curriculum. And that's because in the second semester of the program, you take that lesson plan and you go into a local elementary school and you present on the health sciences. So it's a really interesting way for you to get to like kind of grow yourself, but also to give back to your community and help younger students become involved in the health sciences. So this is open to people who are pre-med, pre-nursing, pre-anything health sciences. And the application actually closes on Friday, and we left it open longer just because we had this meeting with Boise State and we really wanted to make it available to you. So I highly encourage you to apply. We're really excited to have the opportunity to open this up to you. So the link to apply is I don't think it's in here, but I will go get it and drop it in the chat so you have it before we end. And also all of this information is available on the RUUTE website. So you can always just Google RUUTE at the University of Utah. Another program, oh, go ahead.
All right, sorry, I didn't mean to interrupt. I know you were on a wing. I sent it out to the students prior to this meeting, and then they'll get it in the follow-up email once the recording is posted. So if you don't want to put it in the chat, you don't have to, because they'll get it again. So
Okay, awesome. Thank you so much. That's perfect. So yeah, you have the application available. The application is not super long, so you should have plenty of time to complete it before Friday when it closes. So don't worry about that. And then RUUTE Scholars is something else. So if you're applying to the University of Utah School of Medicine right now, or if you even applied next cycle, in your secondary application for the School of Medicine, you'll see the opportunity to apply to RUUTE Scholars. Each year we accept 20 matriculated students into the program. And this is really if you're interested in committing to all of RUUTE's values. So if you really want to participate in all of our programs, if you want to be involved in our community outreach, leadership, and rural underserved clinics and rotations, this is a great program for you. And it's really a commitment saying, I am committed to rural medicine and I want to participate in these programs. You get kind of direct relationships with RUUTE and mentorship from us and from our faculty members. And it's an incredible program. So I highly encourage you to apply to that if you're applying to the School of Medicine and it interests you. So yeah, those are the two large things that you can do right now to get involved if you're in either position for that. And then just a little bit more overview of if you were to matriculate to the School of Medicine as an Idaho student, you would be involved in RUUTE and Idaho affairs once you get here. And I would kind of be the person that you would work with a lot. And there are many programs available to you as an Idaho student once you come here. So we have things such as shadowing available between your first and second year of med school that we can send you back to Idaho to participate in shadowing. We have Idaho rural outreach programs where as a med student over spring break and Christmas break, you can go back to high schools in your hometown and present on the health sciences. RUUTE itself has research programs available. And we also send you back to Idaho for your third year family medicine clerkship. And we're exploring other clerkships to send you back to Idaho as well. So there's lots of opportunities and support for you here as an Idaho student. We definitely love having you here. And so we're very excited that you're interested. And I will pass it to Kylie. Kylie, if you're still on, I can't see all the boxes, and see if you have anything additional to add about RUUTE and Idaho affairs.
I don't have anything to add. Laura did a fantastic job summarizing it. We just really enjoy working with all of the Idaho students, whether that's through RUUTE Scholars or as you matriculate from Idaho. So we're really excited to work with you and see if you have any questions for us. So thanks so much.
are there any questions for the group, for the RUUTE group? That rhymed. This is a fabulous opportunity to gain more experience and interact with other physicians. I know you're all freaked out about that right now because it's really hard to get it. Hint, hint. Okay. Awesome sauce.
Awesome. So Tyler, Ali, and Sadat, if you guys want to share any of your experiences that you've had, whether it's the transition or experiences you've had during medical school, go for it. And then students, if you have questions, just go ahead and ask them.
I can start us off with one of the questions that came from those who couldn't make it. What do you feel students makes Utah the School of the University of Utah School of Medicine special?
So I think that I mean, everyone knows that it's just like a beautiful area. If you love the outdoors, you love to ski. That's just, everyone loves that about the school. And it really is pretty wild to be right next to some of the best mountains in the world. So that's just great in general, but truly the support that you get is pretty wild. I've talked to some other students at other schools, and I mean, the support is, I'm not trying to bash another school. It's great. It's going to be tough, but like they've said, when they've struggled, they didn't know where to go or what to do. And here there's like an entire wellness program with like 8 therapists that you can see at any time for free. I mean, you talk to like any student and they're probably going to be seeing a therapist. It's pretty wild. And then the Idaho program, like I'm with Idaho, and Laura has, like, we wanted to form a program that kind of, well, I guess she kind of started it, but we all just jumped on board and got that formed in like just a couple months. And now we get to go talk with Idaho high schools, which I thought would take years to form a program like that. So just the support you get and the opportunities that you have is, I didn't expect that coming here.
Yeah.
I can jump off of what Tyler said really quickly. I would say similar, like the amount of support that you get at the school, like the wellness center, they've increased like the number of therapists and things that they have, like they have events all the time. And going through the process of applying for residency, like they have, I was like really surprised at how much support that we get actually, like going through the whole process, kind of every step of the way. So, and I've heard as well at other med schools that they don't have that too, or as much. So that was a pleasant surprise. So I would say there's a lot of help for you if you want it. They have an academic success support center that can like help you before you take step 1 and step 2 exams and things like that. So I think that's a thing that really helps them stand out.
Yeah, I would agree with both Tyler and Ali. There's a lot of support here. I mean, continuing on that, one of the biggest things that, makes University of Utah special for me is mainly like the professors. Like I've just been taken aback by how the quality of the professors that they have here. And it's just like the sheer knowledge and information that they have about the topics that they teach is incredible. Something that I definitely was not, particularly used to. I mean, in undergrad, I wasn't really a class goer anyway, but like in med school, like I actually would prefer to go just because I learned so much just being in class. And then on top of that, just the people I've met, other students, other people that go to the University of Utah. It's been an amazing experience just meeting them.
We have a question in the chat. Do you have any tips for finding shadowing opportunities? I am from out of state, so we do not have a primary physician here that I can reach out to, and I'm not sure where to start. Maybe that could come from like the Boise State students or any students. I mean, Ali, how did you get shadowing experience?
So what I did, I called every clinic. So I'm from Boise. I literally called every clinic in Boise like 5 times. Like any specialty that I was interested in, I made like a list and I called them all. And the first time I didn't get much back. The second time I made another call, and then I went into all the clinics that I would prefer to go into to shadow. And I had like a little letter written, like typed out. It's pretty short. Like, hey, like I'm really interested. I'm a medical student. If they show that to any of the doctors in there, I guarantee you at least one person will call. I had like 5 calls like the week after. So it's possible.
I would say in my 3rd year for our family medicine rotation, which if you come to the University of Utah as an Idaho student, you have to do your family medicine rotation in Idaho. So I did mine in Boise at this clinic called, it was like Capital City Family Medicine. It's like a St. Luke's clinic. The doctor that I had there was great. He likes working with students. I'm sure he'd be open to having like students shadow in that clinic. I think there's a few other physicians and even like like PAs and NPs. You could also, I think, like shadow them too. And that would have you guys get good like primary care experience. So I would try to call that clinic. It's Capital City Family Medicine. I can like put it in the chat if you want. I think that would be a good option for people if you're in Boise.
So to follow that up, I do have a question for the University of Utah School of Medicine admissions folks. In terms of shadowing, observation, and gaining experience in patient exposure during a pandemic, what advice could you give students in terms of looking outside the box, and how is the University of Utah looking at observation and the difficulties that come with getting it during a pandemic?
I can take this one. We have seen a lot of creativity of people finding ways to get involved to both help with pandemic efforts and maybe looking at different types of clinics or different types of facilities that they could get involved in. It's definitely been difficult, especially early on when they, like pre-vaccine, when people were not allowing really anyone extra into different clinics. But we and the committee do understand that it's different. Getting shadowing is hard. Shadowing was a little bit hard before the pandemic. So just getting that clinical experience in any way you can, really, and what you can gain from that and what experiences you pull from it are more of what we look at than, oh, you went to this prestigious hospital, you shadowed this doctor for this many hours. Obviously, there are hour requirements, but if you volunteered at a optometrist or a oral surgeon or a diabetic clinic or a hospice or something where you are interacting with patients, you are shadowing, you are kind of getting a feel for what it's like to be in these clinical environments, that is just as valuable. It doesn't have to be an MD in a hospital to gain those experiences. You can do, we've seen nurse shadowing, a surprising uptick in oral surgery and dentistry. So while it's not directly medical, I mean, oral surgery is still surgery. So it's seeing the different varieties and different types of medicine and different clinics. Phlebotomy we've seen, physical therapy we've seen. So there's been a lot of creativity and initiative that we've seen from students of, I wanted to get involved, what's possible for me. I started this fundraiser, I signed up to be a COVID tester, I was able to get certified and give vaccines, things that are showing that it's still hard, but you're still trying. That initiative and that drive goes a long way.
Then we don't just require shadowing hours. The clinical experience can be working. So like Emily said, if you're CNA, EMT, phlebotomist, those do count under that clinical experience. So it doesn't just have to be shadowing hours.
Can I ask a quick question on top of that? Just on like the slideshow, you said scribe along with the CNN. How do you guys view that? As because it's obviously not patient like hands-on because you're not allowed to like touch the patient or anything. So how do you guys view that as a university?
We see scribing a lot. We think that's a really good experience because you are in the room, you are kind of a part of the appointment, even though you're not putting hands on, because we also understand that not everybody gets to do that, which is maybe for the best. You need to have a qualification to be able to actually physically treat. But scribing is a great experience. We've seen a lot of translators if you speak additional languages. Just really getting on the floor and in the environment is kind of the base experience that we go for. So if you're like working in the back of a pharmacy, or if you are kind of doing the front informational desk, that's not so much experience that counts. But if you are scribing or taking vitals or providing any sort of care to the patient, that is perfectly acceptable.
Would
Yeah,
you?
Zach, I was a scribe. Oh, sorry.
That's okay.
I was a scribe for a year, and it was like, I mean, there's no other job where you really get like 8 hours or 10 directly with a physician, and in your off time you can just grill them with questions before you frustrate them or they tell you to shut up. I don't know, but it was like I was able to talk about it a lot on my essays. I put it down as clinical experience, and I never got any questions or anything, and it seemed to be fine. So I'd highly recommend that unless you're already doing it. But yeah,
I did the same thing. I was a scribe too for like a year and a half.
Yeah, same. I think a lot of medical students are scribes. It yeah, it definitely translates.
I imagine that the admissions team would also agree, though, that that's not the only thing that you can do to gain experience, because in the pandemic in the Treasure Valley, we lost some of our scribing ability. So they went down to a smaller size space so that they could manage the rooms and protect patients and those workers. What I'm hoping to hear, and I think you voiced it, Emily, really well, is that it's not a set number of hours. If I can push you all to stop thinking about the checkbox mentality, don't think about how many hours you have to have. Think about why they're asking. Why, Allie, did you go and observe physicians or work as a scribe? Well, it was to gain experience, make sure it was the right fit for you. And so choose things for yourself that are going to allow the University of Utah to see you in the best way that they can, to see you as a genuinely believing this is what you want to do, to see your authenticity and that this is your heart, this is where you're set to do. You know, Saeed, I imagine that your experience, your background in wanting to do counseling probably enlightened your patient exposure piece. And it's a different venue than just scribing. So I love scribing. I think it's great, but it's not for everybody, and not everybody gets an opportunity to participate in those opportunities. So I just want to really voice that out there. And I appreciate Emily and the University of Utah sharing that they're looking for a well-rounded candidate, somebody who has really stepped up and not looked about how many hours they need to gain and looked at why they should do it.
Yeah, and I don't want to minimize the hours because there are hour requirements and suggestions, but don't just like do something for an afternoon and be like, that's good enough. Or like, I got my 100 hours, I'm out. Like continued involvement and continued activity helps add to those hours, because there are, I guess there does need to be a quantifiable way to kind of measure activities. So hours are still important, but they're not the only thing.
I just want their focus to be on the right thing.
Yes, yes, definitely. So it's
the hours come, right? Like if you
yes.
love doing it, keep doing it. Other questions?
I guess this is a question for the med students. Since I am scribing right now, and it's very overwhelming because you don't really need a whole lot of certification in terms of like medical experience to be a scribe. And when these doctors are talking to you, you just feel like the dumbest person in the room because you don't know how to spell these words, you don't know how to pronounce these medical terms. So how do you guys kind of tackle that issue of feeling so defeated? I guess I'm feeling so defeated in this job right now because I'm only a junior right now, and all these words that they're saying to me, all these like medical terms, like references, I don't know what they're talking about. And it just feels like a mountain of like, I'm never going to get over this. So how do you guys approach that when you're in your scribing experience and taking it on to med school?
Well, for me, it never went away. I'm still confused to this day. But no, honestly, I think the best way to go about it is, you're every day you're gonna hear something different that you don't know, and the best thing you can do is go home, look into it. Like I wouldn't like spend so much time on it, but like if it's something that like it's coming up constantly. I did pulmonology for my scribing, and there's a lot of things that would come up, certain abbreviations and things like that. So I'd go home and I'd look all those up and kind of like keep like a little list of them. So like every time they came up, it would be a little bit easier for me to, associate it to that specialty. If you're working in multiple specialties, then, it's a lot more difficult. But since I wasn't just in that one, it was a little bit easier because over time I was able to pick it up. It sounds like you might be, are you just starting out as a scribe, or have you been doing it for a while?
I'm on my like 6th solo shift, so it's been like under a month. I'm in the ER too, so that's why it's like there's so many different cases that you see in the ER. And Allie's actually been doing it longer than I am. So she has more experience than me.
I was in an ER too. I would say if you're feeling overwhelmed about it, like your job right now isn't honestly really to like understand all the medical stuff at this point. Like it's just to obviously get it down and document it for the physician. So like if you have questions and the physician has time, like I'm sure they'd be happy to. That's like I learned some stuff from them, but it was more, I just asked them questions about like their careers and stuff. I didn't really, so I wouldn't focus like on, I need to learn all these things from these cases. Cause I feel like, you'd get it later on if, when you go to med school. So don't worry too much about that. Yeah, that's what I would say.
Yeah, I had Google up 24/7 every time. And then I'd send it to them and hope it was right. And if it was wrong, yeah. But yeah, definitely I agree. Don't try to waste your time learning all this stuff, because you will. You'll do it every day. So just try to all of my reflections on it in the essays were about like what I learned from a patient interaction, the empathy I saw, my first shift, how I wanted to quit. I almost did, so that maybe that type of stuff. You'll feel defeated every day in med school too. So it's okay. I didn't mean that in a terrible way. I'm sorry. You learn a lot is all I'm saying.
That's why they all mentioned all the counseling services available and support. So
Yeah, you don't feel defeated every day. Don't worry.
Maybe that might be a good shift to ask this question then. How would you describe campus life at the University of Utah School of Medicine?
Well, so me and Tyler started during COVID, so it was not much. But this year has definitely, we've seen a definite rise, and it's become more lively. And, there's events like our first year, we don't have any like lunch events or like in-person meetings with other students. So it was tough to meet people. So now it's definitely, we're able to see it more this year. Just like, we have lunch meetings for specific student interest groups, and they provide lunch, and it's definitely you definitely see it more now as a second year.
Yeah, just to tag along with that. Yeah, you don't feel defeated. Sorry, that was my stupid humor. It really is great. It's fun to learn this stuff, and you're gonna have a great time. But yeah, I do like that it's pass fail for the majority of things. There's like small little rankings, but a lot of schools don't do pass fail, and you're consistently compared to each other. And I've heard that kind of it's tough to share experiences or what you learned or resources with other people. Since it's pass fail here, the first 2 years at least, I haven't had any of that, and I feel like I've had relationships that maybe wouldn't have formed with more competitive people because of that.
I have lots of them, so pipe up, ask questions.
I'm not a student, but I will say from my perspective, more in admin, our students are so engaged, and that's really an amazing thing. So for example, the 3 med students you see on here now, they're just volunteering their time. They just really love Idaho. They love helping. And I think that's something you see with a lot of our students, and it kind of helps a lot. I think, if you don't know where to make friends, or you don't know how to connect, these interest groups, these people are very engaged and very motivated, and that's just a really good way to find community. And I think I've been very impressed with the students as far as their engagement and their level of participation and giving back. So that's, at least from my perspective in admin, I see them being very engaged, even through COVID, which is difficult.
I'm going to ask this question because I know Tyler might know the answer. What do you feel are the differences between what you're learning as an allopathic medical doctor and an osteopathic medical school?
Okay, yeah, so I only applied MD my first year, didn't get in, did some more stuff, applied DO and MD, got 4 interviews, got into 4 DO schools. I was gonna go to Des Moines, and I thought it was great. I wanted to do physical therapy before med school. Like I was deep into that until my junior year, and I thought that'd be perfect. You get the allopathic sort of hands-on thing. Maybe that'd be a great way to tie my love of physical therapy into medicine. And so I was excited for that. And as I talked to more and more students, I thought it was like a massive difference in philosophy and everything. And they say there is, and there is, but in reality, you have one more class, and it's that manipulative medicine. And if you decide that's not for you, which, to be honest, the majority of students I've talked to at these DO school interviews, like it's not for them, and they decide, I'm just going to try to be a practicing physician. But it's nice that you have the opportunity. That's all I would say. I think that I thought there was a big difference, and by going to a DO school, now I was at a massive disadvantage and I'd be practicing differently. And it didn't seem like the case. And when I got into University of Utah, this was my dream school. So obviously I was stoked. But the more and more people I talk to, especially like even admissions at DO schools and current students, they didn't really see a huge difference at all. Just the choice you get, whether you want to do that. I also have a friend that's going to do a fellowship his 5th year in manipulative medicine through a DO school. And then others that just kind of do it to pass the class. So it's really just one more class and one more option if you go to those schools.
Thank you. All right. Other questions for the room? You can put them in
I
chat.
asked a question about the RUUTE program.
Yeah.
So I just am wondering, what's like the fine line, I guess, that you would define like rural medicine as? Like I grew up in Montana, and so everything there to me is kind of considered rural, especially in comparison to being like in a city like Boise. So I just am wondering like where you guys draw that line to like making that decision of like devoting yourself to a career in rural medicine.
Kylie, you want to take this one?
Sure. I was gonna wait, but yeah. Allie, great question. So the RUUTE program itself, if you were to actually look up rural and underserved definitions for like a national, state, even Utah or Idaho statistics or definitions, are going to be very different across the board. So for the RUUTE and underserved definition that we have within the program, it's very, very broad. So on our website, we do have a true definition of what we would consider rural, which is going to be a city or a town less than 30,000 people. And then underserved would be anywhere from 30,000 to about 90,000. And then after that, we would maybe consider it urban. But I don't want you to also going back to comments of being defined by definitions or criteria. So we really are looking for students' experiences. So we have so many students that are in the RUUTE program that, let's say they were born and raised in Salt Lake City, but they've had a ton of summer experiences in rural medicine or rural areas of the state, or even places in Idaho, Montana, and they wish to go practice medicine in those areas or learn more about that population. They would be a perfect RUUTE scholar. So we're really looking for individuals that are interested in learning about rural and underserved medicine, that wish to go back and practice. Even if you don't wish to go back and practice, that you have an intention of serving those individuals or something of that nature. So going back, it's a very broad definition, and we kind of turn it back to the applicants applying and saying, well, what do you think rural and underserved is? Because most likely it will fit within our definition if that's the population that you truly want to serve.
And I will add that the RUUTE Scholars Program, that's a designated, you apply to that, there's 20 students selected for that. You apply as you're completing your secondary. If that's not what you do or you're not selected for that, the RUUTE program, once you're matriculated, is open to all medical students as well. So being a RUUTE scholar is kind of dedicating yourself to committing to that through medical school. But if you just come to the School of Medicine and you're sort of interested in a little bit of RUUTE here and there, you want to do a rural clerkship, or maybe in your 3rd year, you want to do some research, or, you know, it can be more of a, I want to use the word smorgasbord, but I don't know if I'm pronouncing it correctly. It can be more of kind of a buffet of whatever you want it to be. So there's 2 options regarding your involvement with RUUTE.
Okay, thank you guys. That really clarifies things.
All right.
I had a question for admissions, Aaron, if that's all right.
Yeah, this is your show. I'm asking questions that the students have asked that couldn't come. So you go ask a question. You're here.
So you guys are like on the slideshow was talking about like the average of like the 3.78 GPA and MCAT of 513. Do you guys have the statistics of your lowest accepted applicants from the last year?
Oh, Miranda, if you have the stats, you can go ahead. We don't, not offhand. The data in the slideshow was the sort of average of that acceptance year of like those 125 students, of kind of what their average was. But as long as the minimum is met, of which is it's a 500 and 3.0, that meets the requirement. So it's not like it's a part of the consideration, but it's not like the end all be all for it. So as long as you meet the requirement, that sort of gets you in the door on that front.
your statistics would be on the MSAR though for the last year. So my advice would be, Zach, if you want me to look up Utah statistics, I can do that. Because I have access to the MSAR officially, so I can look at what your last year was. But anything else, Zach? No? Okay. I wanted to ask about clinic rotations. So we had quite a few questions in reference to clinic rotations. So maybe the students might be able to help support answering some of these. One of those was what types of clinic rotations which types of specialties do you get to see as a clinic when you do your clinical rotations? And what opportunities do you get to do clinicals before clinic rotations start your 3rd and 4th year?
I'm happy to kind of answer this question because I think I don't know if the other students on here are 2nd years, so they are going into their clinical rotation soon. But so first I'll say in your 3rd year of medical school, you start, they call them clerkships. So you have to do 6 core clerkships. So it's family medicine, internal medicine, surgery, and internal medicine and surgery are the longer ones. OBGYN, pediatrics, and neurology and psychiatry. So it's actually 7, I guess. So you do all of those and you get like a couple weeks of elective time. My year, because of COVID, our rotations were like a little bit shortened, I think, but I think they're typically 4 to 6 weeks. I think that IM and surgery are maybe 8 weeks long, but anyway, so you do those, you get tons of exposure. You're in the hospital and clinics and stuff. Before that, in the first 2 years, and probably the other students can speak to this too, there's like student run clinics that they have shifts that you can sign up for. There's one in Midvale, Utah. And I'm blanking on some of the other ones. There's like a couple more. There's a 4th Street clinic. And you can like volunteer at them like multiple times per like semester per year. So I would say that gives you some exposure before your clerkships in your 3rd year. And then you have a few required rotations in your 4th year before you graduate, mainly in internal medicine and whatever specialty you're gonna go into. So yeah.
And then to follow that up, opportunities for research before and during clinical rotations, are those available?
Yeah. In your first 2 years, there's tons of faculty members that you can contact. That's like it's kind of what I did. If you want to like contribute to a research project, see if anyone's doing anything. I think after your first year, there's also a program, I can't remember what it's called. It's like a dedicated, after the summer, after your first year, you can do a project, and then they have like a little poster conference session thing in the fall of that year, I think. I don't know if any of the other students did that. I personally did not do that. Yeah, MSRP, sorry. Maybe you can speak to that.
Yeah, so I think the application opens up in like January for medical. It's like a medical summer research program where you kind of dedicate your summer for research. A lot of students like to do it. You don't have to. Like, you can spend your summer doing what you feel like you need to do. I did do research over the summer. I was interested in a specialty, and I reached out to them, and I got solidified a research position for the summer. A lot of students will say that they do that just because, I don't know, it makes you stand out a little bit, and it gives you a little bit of introduction to the specialty. I was able to shadow with him in clinic quite a bit, and I got to see kind of where he goes research wise in that field. So it's really eye-opening. I learned that I probably won't do research in my career, but some people like it, some people don't. So
Yeah, just one last thing to add. Everyone thinks you have to do research. It goes back to checking boxes. You really you get into med school, and as much as you don't want to check boxes in undergrad, there are things you have to do. You have to do things to get into med school. Once you're here, though, they know you're smart, know you're capable. It's about finding what you love and what you want to do. A lot of the times when you're talking with residency, like at interviews, I've heard that it's just like one connection you had with a physician or one experience that you connected with the physician about, and all of a sudden you're working a 5-year residency with them. So just keep in mind that if nonprofit work is for you, if volunteering with people with disabilities is the thing for you, use your time toward that. I know a person that worked in a nonprofit in California all summer as well. And I'm sure that's going to go a long ways for him. So just keep that in mind too. And research, last thing, I thought research would just be impossible in med school. It's this big, crazy thing. It's not. There's tons of people that came here with 0 research experience. Probably more have no research experience, or at least little, that have like a lot. And you just email people and they let you do it. So it's really not as scary as it seems if you do decide you want to do that.
Yeah, I totally second that. I came into med school with like 0 real research at all. And there's tons of research opportunities here if you want it. But I would also say you really don't, like, if you think you don't, I don't know, don't start something if you like aren't, super interested in it. Like I started something in one specialty kind of, and then I'm not going into that. And so just, I don't know, it's better to do one thing and be more dedicated to it than try to do like a bunch of different things. I think anyone would say that, like, once you're in med school and you're going to later on apply to residency, like they want to see more like dedication to one specific thing. I think that's more important. So, but yeah, if you don't want to do that much research, you totally don't need to as much as, yeah.
And I will just wrap it up and say that RUUTE does support summer research as well for rural research programs or rural research interest. So that's another option if that is what you're interested in.
All right. In terms of residency and match process, do you guys have your like statistics of like who matched where last year that you might be able to share with me? I have a couple of students who had questions about what specialties are out there and kind of the where you're probably in the match process, maybe you could share a little bit about what match feels like and what the process is like.
All I know is in terms of like the U specifically, their match statistics, it's somewhere on their website. Yeah, I think someone just put it in the chat. I'm pretty sure it has it like by specialty, like who applied, and how many, and like I think it even says what programs they matched at. I'm pretty sure, like what areas, if that's what you were asking. Yeah.
Yeah, I was looking to, I know you guys keep those statistics, and so I thought it would be easier for students to see that. So thank you for that. What's the match process like?
Good
So
question.
You're just starting it, aren't you?
It's, I would say, I was nervous. I mean, obviously it's still nerve-wracking to me now, but the whole process, it's kind of like applying to med school in terms of like you have the portal on the AAMC website where it's like applying to med school with AMCAS, blah, 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 except it's called ARAS. But I feel like it's a little bit more straightforward, honestly, than the whole application to med school. You have, you kind of just list all of your experiences. You have a couple letters of recommendation, has like your application has your board scores on it. I'm trying to remember what else. Oh, and like a personal statement. It is, I mean, depending on what specialty you're going into, it is, some specialties are way more competitive than others. But I will say, like I said before, the U is like super, super good about, like we have meetings like once a month as 4th years to go through the whole process. And so I was very pleasantly surprised by that. Yeah, I don't know if anyone has any like specific questions about the match, but that's very far ahead in your guys' future. So I wouldn't worry about that now, but yeah.
I was going to jump on that real quick. Yeah, we're literally like going to start rotations in like 6 months, and we have no idea what that whole process is even like. So you have a long time. And the good thing about the U is a lot of people do match. They've consistently had more than the national average.
Oh yeah.
You're going to be just fine.
And if they feel like you're not like realistic or something about what you're going to go into, like they'll help you figure out kind of options and what would be a good fit for you, I guess. So there's a ton of support for that process. So I wouldn't worry about that at all.
Questions from the room, or I'll just keep throwing them out. I got a couple more left.
I have another question for the students, Erin.
Yeah.
Did you guys, I know Tyler briefly talking about like physical therapy. Does any of the three of you guys ever think about maybe going PA or on the fence about PA to MD or even DO? And what was like the leaning factor for you to go MD? Because I know for a lot of people, like that 4 years of med school, the student debt of it, and then like 3 to 7 years of residency can be very daunting, and some people will go other paths. So what made you want to make that commitment to all that?
So I guess, yeah, I mean, I started physical therapy, and I just wanted to do, I just didn't think I'd be happy as I don't know, I've always been, not that physical therapists aren't driven, I'm not saying that at all. I just always wanted to learn more and more and more. And I didn't want to be someone that had to sort of, maybe I'm stubborn, I don't know, like always be referring or always get referrals to do things. I wanted to be the person doing those things, and whatever that took, I wanted to do that. And it's very noble to do anything other than that. I just know that I probably wouldn't be happy in that position. And that honestly was kind of what it came down to. I just wanted to be kind of the end of the line. Like, I'm going to take care of this. I'm going to do this. I want to do ortho. Like, I want to cut the bones. I want to do that. I don't want to be the person rehabilitating them after that. I thought that PA would be kind of compromising, and it would be kind of buying into my anxiety and my lack of confidence. So that's why I didn't make the switch from physical therapy to PA, and I went straight to medicine, MD.
Yeah, I mean, I started out going into counseling, and I mean, for me, so the original plan for me out of undergrad, like I got a degree in biology at Boise State University, and my initial plan was, my mom was a doctor. I was like, yeah, I'm just going to be a doctor. But I came out of undergrad, and I hadn't done anything to even make myself competitive for medical school. I had done research. That was about it. And I was like, I don't even know what it means to be a physician. So I got a certain opportunity at a clinic, and I worked as like what they call a peer support specialist. And I got experience in the psychiatric field, and that pushed me towards counseling for a while. And while I was there, I was like, you know what, this isn't something that I could see myself doing long term. Because I would sit there, I'm like, okay, I can only do so much to help these, patients. There's not much I can do in terms of being involved in their care. Like, all I'm doing, I'm getting the recommendation from the psychiatrists and, their healthcare team about what, what I can do in my personal ability to help them, which was great. But I wanted to be more at the precipice of like what it was that was going to help them. And I realized, okay, well, there's someone that's making these decisions. That was a physician. In most of those cases, it was a psychiatrist. So I was like, you know what, that's I think I cut out, but yeah, I think that's essentially the reason why I decided to go this route.
Yeah, I would say for like in undergrad, I considered maybe PA for a while. I think I considered nursing too. I was told by a few people, oh, you should do PA school because it's, shorter. You're a woman. You should, it'll take less time, blah, blah, blah. You'll have like more time for like family and stuff. But I feel like that's not a good reason to go to do PA school. And that's not really true, actually. I feel like, but I would say the same thing. Just me personally, I don't think I would have been satisfied going to PA school just because it's 2 years, which is great. And they like are super, super helpful. And I guess one benefit of PA school is that you're more, I think you have a little bit more options in like where you can practice. Same with like nurse practitioners. Like if you want to do primary care for a while and like do pediatrics or work in an ER, whereas if you're a physician, like you do your residency in one specific thing, and then you become like board certified in that. And then you typically only do that. But I just feel like the breadth of knowledge that you have as a physician, that's just like what I wanted. So once I pretty much figured out that about myself, I didn't really look back or look at going to PA school. But if it's something you're considering, And if it really is like, if you think the amount of time it's going to take for medicine and residency is going to be problematic or something, like, I mean, PA is a great option too. Just depends. But if you really think that you're leaning towards medicine, I would maybe try to go that route if you're like really hesitant, because I don't think you'd regret it.
All right, I have a couple of questions that are related to the admissions folks real quick. Just so predominantly you accept Idaho and Utah. Do you accept any out-of-state students, and what kinds of criteria would you use to accept an out-of-state student that wasn't from Utah or Idaho?
I can take this one. So we do accept out-of-state students, and it's the same criteria for everybody else. The nice thing is for each group, so the Idaho students are competing for just those Idaho student spots from the Idaho pool. So you aren't competing against all the Utah students for a spot. So it does make it a little bit nice. You only have to compete against your pool for a spot. Out-of-state students, I believe, true non-residents, we have 10 seats, and then those Idaho are those 10 seats as well.
And I can add on to that as well a little bit. True non-residents, it is, they are more limited, so it is a much more competitive pool. We don't want to discourage anyone from still trying, because we want to see everyone and we want to give everybody a shot, but it is a much more limited selection. So we, like with Idaho and Utah, you have your designated seats and you know kind of what you're going for, but that's just 2 states out of the other 48 plus Canada and other international spots. That's a very large pool for very few number of seats. So we don't want to discourage anyone, but we also, I mean, you can see on our website what our acceptance numbers are, and unfortunately we can't accept everybody. So we still encourage them to apply, but it's also a much more limited number of seats.
Great. Thank you, Kylie, for putting the information about contact information in the chat.
Aaron, sorry, I feel like I'm only asking all the questions. I'm just a curious person.
Oh, we want you to ask the questions. That's why you're here.
I feel like I'm the only one though. But I just like going back to what you guys were saying. You said, was there 5 Montana spots as well on the slideshow? I thought I saw like a 5 Montana.
Yeah, there's no contract for Montana and Wyoming like we have with Idaho. We're trying to get one, but just to kind of add to our class and support our sort of Mountain West area, we do try to accept 5 or 6 from Montana and Wyoming. So they're not designated seats and they would still be considered non-resident. But we do try to accept from those states to sort of build those relationships so we can eventually build a contract. But there is no like official, these are 3 seats just for Montana. It's just something we try to do because we're one of the only medical schools in the area among these states. There are others, but there are not many.
Yeah, and I will just follow up on that, Zach. So I think I mentioned earlier, I'm the coordinator for Idaho students, Montana students, and Wyoming students. So there certainly are Montana and Wyoming students, and they're fantastic. Typically, I see just on average about 3 Montana and 3 Wyoming per year. So right now, of all 4 years of medical school, there's, between 6 to 9 to 10 of each of those states. And those students are very involved, and we have initiatives to also try and get them back to Montana and back to Wyoming for clerkships, shadowing, research, and such. So if you are kind of a home resident of one of those states, or someone who is, we're definitely supportive of those states. We just don't have quite as formal as of a relationship as we do with the state of Idaho.
Elsie has a question. She's a chemistry major. Majority of her time is outside of class right now, going towards research. Is this a disadvantage, or that she doesn't have a time to focus on clinical experience where she's focused so much on research, or does my time doing research offset that to some extent?
Yeah, I think some people might have a different perspective, but I mean, I personally, from a perspective of like just going into medicine, it is such a time investment in general just to go to medical school, become a physician and all that. I would highly recommend to actually get medical experience, because you don't want to be in medical school after taking out loans to realize, oh, like, maybe I shouldn't have gone into medicine, or like to become a physician in specifically. And you don't want to make that realization in medical school. I would highly encourage, you to find at least some experiences that get you an idea of what medicine is like.
Shadowing can do that too, though. If shadowing is a huge part of your application, then make that a big part of your application. On top of that, the first 2 years really are a ton of book work. And if you like science, that could possibly, I don't know, I'm not in rotations yet, but there's so much science. And if you like that and you nerd out about that, like sometimes that's enough for people too. And but clinical experience is very good. And it could be as simple as like working at like volunteering, maybe 50 hours at like, I don't know, what did I do? Hospitalist. Oh gosh, can't even.
Arts and Home Hospice.
Yes, I think, yeah, that was it. Yes. So, and that was great for me on top of the scribing, but, and then I know someone here that didn't get any clinical experience, but they did like clinical research. They spun it that way and used half their hours toward that. So any which way you write your application, just make sure it's you.
Yeah, I would say hospice was the other experience that I was trying to think of that is also a good option for a lot of people, because you do get a lot of like patient exposure. And I think there were a lot of places in Idaho that I remember that were like really wanted volunteers for that. I don't know with COVID, obviously, if that changed that, but I seriously, I did consider doing like volunteering at a hospice place too. So that would be a good option. But I would say in terms of application, like, yeah, I mean, if you have some research, that is fantastic. You do still need some like clinical experience though, that is important. But if you have like more research and like a little less clinical experience, I don't think that matters. I think that's fine. What was I gonna say? Yeah, you just want to make it like true to, your application should be true to like your experiences, and you should have a good reason why you want to go into medicine. I know of some people during the first year or so of med school who ended up like joining the MD PhD program because they really wanted to. There was like 1 or 2 people, I think, who ended up doing that. So if you really like research or something, or if that's something you want to do, like you can certainly still do that. And like you could have a career as an MD PhD and like, not do as much clinical work and then like do some research or something. So yeah, if that makes sense. So I would say it can be tilted one way or the other. You do need a little bit of both though, probably.
Yeah. And adding on to that from the admission side, as far as reviewing applications, and tacking on to what Sajad said, the actual like on the floor clinical experience is important, and it does help you decide if this is what you want to do. Because if you end up like deciding like, I don't really like being around sick people, it makes me sad, medicine's maybe not going to be the place for you. But you don't know that until you do it. Like you think you'll be okay with it, but then maybe there's like a really sad day. Like medicine's not easy. And being on the floor, being in the field, talking to physicians, being in clinics, being around, I don't know, maybe someone whose arm is hanging at a weird way, like that stuff you need to experience to know if this is really a path for you. So trying to get that before you commit to the applications and the money and everything to go through the whole process of medical school, kind of getting an idea of it beforehand is definitely helpful. And it strengthens your application as well to show like, oh, you have actually participated and been in this environment instead of sort of being adjacent to it, being actually in it helps your application.
One quick thing I'll add, it's not always going to be amazing. I didn't love my scribe experience. It was a great program, but I'm not going to do emergency medicine, and it's probably because of that. But it's not just that one experience that tells you medicine's for you, right? It's everything else. But like Emily was saying, you do need some clinical experience to make sure that you know what you're doing. This is for you. Even though emergency medicine isn't for me, some of the experiences I have with the physicians and the patients and everything, which was more of a medicine thing in general, that stuff was the stuff that told me I want to do medicine. But 90% of it was like, I don't think emergency medicine for me. And that's kind of nice because in rotations now I kind of know.
So you were talking about the MD PhD program, but I'm really interested in maybe doing like the MD MBA or MD MPH programs. So I was wondering if any of you were a part of that, or if you have friends that are, and how that affects like your course load.
Yeah, that's a good question. I did not do that. There's actually quite a few in my year who are doing a MBA. I think there's a couple doing MPH too. So I believe how that works is you do everything the same, like your first 2 years. I think you take your first board exam, then most do your third year with all your clinical rotations, get that out of the way. And then you have that like year in between third and fourth year. And that's when you do your master's program. So a lot of people, after they did our third year with us, and then they are not like participating in the match this year. So it really doesn't change. Like, it's not like you have extra coursework on top of your like medical school stuff. It's like a kind of like a in between, as far as I know. I've heard the MBA program's pretty good. I don't know about MPH and things. That just wasn't something I was interested in, but it's a huge, like, and I think you can decide like later on if you want to do it. You don't have to like go into med school thinking you want to do it.
Okay.
That's all I know about it.
On that note then, so do you have to take the GRE also, or just the MCAT?
That's a good question.
Emily or Miranda, do you know?
I know for MD, it is just the MCAT. I haven't seen anything about GRE in the 2 years I've been here. But I also don't know a lot about the MD MBA program. I haven't had to experience that, so I don't know if it even really happens on this admissions level where I am. I think it's a couple years in to medical school.
We can look for you, Allie. We can look on their website and get back to you on that response.
Yeah.
So question for the medical students, and then I want to be mindful of everybody's time. I have a couple of questions I might filter to either Emily or Miranda they can at least tell me who I can have the students ask this question. But my big question for the 3 medical students are this: if you could give any piece of advice to these students, what would be that one piece of advice you would want to tell them right now? That you would tell yourself if you had hindsight, right? And you have all this information now, what would you have told yourself now?
I kind of have to go right after this, so I might go if that's okay. I was just, one thing I've thought about a lot is like, I struggle with like confidence and like thinking I'm not doing enough. I'm not going to be enough. I'm not smart enough for this. I think a lot of people struggle with that, but it's hard to realize that at the time. So in high school, I was just working as hard as I can to get to college. And then I was working as hard as I possibly could to get into med school, always thinking I wasn't enough. And then working as hard as I possibly can now to get into residency. And it's like, sometimes you like forget to realize like where you're at. And like how hard you have worked and like the time you've put in, and like maybe you are enough, like you're where you want to be right now, maybe you will be where you want to go as well. So maybe like I'm in my dream school now, trying to go into my dream like career field that I literally dreamt of as a kid. So it's like, that's pretty cool. So like just give yourself a little bit of credit. And I think that's been motivating for me at times that I've gotten really down. I know that the admissions process, the application process is like so rough. But going through like a whole year of rejections and then getting off the wait list at Utah in May, you know, I mean, I know what it's like to feel like you're like not enough, or that you're not doing enough. So just like take some time to realize that like you're doing a lot, keep it up, and you'll get to where you need to be. So.
Thank you, Tyler.
Sorry, guys,
I think, yeah, no worries. I think on that note, mine's pretty similar, and it's like an overarching theme. So for me, I'd say, you know, med school, to get into med school is not easy. For one, it's a very tough process. And if I could go back and tell myself something is, it would be to really figure out what it is that you want to do. Because I struggled trying to figure that out. And it took me a while to, really solidify that. And I was hard on myself along that process, because, I graduated, I did, schooling to get a master's, and then I'm like, okay, I want to go to school more. And I left and, did the process of trying to get into med school. That's the MCAT, that's extracurriculars, it's shadowing, that's clinical experience. That's a lot of work. I think the biggest thing is just like, don't look at it as like this like mountain that you have to climb to get to med school, right? Look at it like, okay, what's the next thing? Like, what am I doing right now? What is the next thing I need to do? Because if you keep looking at what it is that all the stuff you have left to do, I mean, you have so much left to do. But the thing is, if you enjoy the process of going to the current thing that you're doing and working towards that goal, that's all that matters. Like if you can gain enjoyment in doing that, medicine is going to be very good to you.
I would say kind of like what Tyler was saying. I had a similar experience. Like I felt like I was not the best applicant to med school. I like heard some of what like my fellow classmates did before med school, and I was like, oh wow. But I mean, I was super discouraged when I was applying too. It was probably honestly like one of the hardest things I ever did was just like trying to get into med school. So I feel for you guys, and I know it's not the easiest process. It's really hard. I didn't get in the first time too. I applied twice. Like I know people who applied 3 times. So if you apply once and don't get in, like do what you can to change your application, or to improve it, apply again. I would also say just like be open to in med school what you're going to do. Like I didn't think I would be applying for radiology. So if you go into med school thinking you're going to do one thing, don't worry about, you might end up liking something else. But I would say a lot of people, it's a really tough process, and I got in off the wait list too. So, surprises can happen, and, don't be too hard on yourself. Once, pre-med people do a lot. I know it's a tough road. But once you're in med school and things like that, you don't have to necessarily like prove yourself all the time anymore, because they know you're a good applicant. You've done the best you can. So I would say don't be too discouraged by the process. I know it's tough. Yeah.
All right. Thank you so much. I want to thank everybody. I want to leave the floor open for just one more question if we need it, if there's any other questions that we have. I really appreciate everybody's time today, and thank you, and let us know if we can help in any way. And of course, I want everybody to give a round of applause to the University of Utah. We love them. Thank you so much. And good luck with the rest of your semester, students who are here at Boise State, and the same to the medical students. And